Obesity is a chronic disease that is increasingly common today. The definition of obesity is excessive fat accumulation in the body. It reduces the quality of life and causes serious health problems such as diabetes, heart disease, fatty liver, sleep apnea, cancer, high blood pressure, gallstones, stroke, breathing problems, osteoarthritis, depression, high cholesterol. Gastric surgery is still the best way to eliminate excess weight that doesn't respond to diet and exercise. Usually, diet and exercise are not enough for severely obese patients. The success rate of gastric sleeves is approximately 75–80%. People experience excess weight loss of about 60–70% within 1 year of surgery. The goal is to enable our patients to lose weight permanently and overcome the health problems related to obesity. Gastric sleeve surgery is suitable primarily for patients with a BMI of 32 and above. Patients can lose 40 to 100 kilos, 88 to 220 pounds with gastric sleeve surgery. Stomach capacity drops by 1/3, and patients rapidly lose weight. The conditions that typically improve from losing weight after gastric sleeve surgery: obstructive sleep apnea, type 2 diabetes, heart disease, infertility, joint pain. Patients must change their diet and exercise habits before surgery and develop physical activity habits to help them recover. This reduces the fat volume in the stomach, relieves the cardiovascular and respiratory systems, and makes everything easier for surgeons and patients. They also need to quit tobacco products or alcohol at least 1 week before surgery. Surgeons use laparoscopy and general anesthesia to perform gastric sleeve surgery. They enter the stomach through a single or 4 or 5 holes. Then they remove 80% of the large and curved part of the stomach with staples. After stomach removal, they inflate the abdomen with special dyes to check for leaks. Lastly, they remove the laparoscopic instruments and place the drainage system as a safety measure. Gastric sleeve surgery takes about 45 minutes. The most important thing is to ensure that patients do not regain the weight. After surgery, our specialists monitor patients closely. During the first few months, patients need various medical checkups. At this point, patients should be able to control their appetite. They follow a nutrition program under the doctor's supervision. Dietitians recommend liquid diets after surgery. Patients can switch to solid foods after 1 week. They need to avoid foods that contain caffeine and sugar and drink plenty of water. Also, they need various vitamins and mineral supplements. Patients can start to walk on the first day. Usually, they stay in the hospital for 2–3 days. Minor wounds on the abdomen disappear in a few months. Also, patients have to wait a year for pregnancy. Losing 60–70% of the excess weight, feeling full, eating less because of a smaller stomach, low appetite hormone, fewer vitamin and mineral deficiencies in the long term, radical improvement in health problems, snoring and joint pain go away, better freedom of movement. The considerable compilation rate of gastric sleeve surgery is 1 in 1,000. Complications due to stomach narrowing and gastric rupture are considered a risk. Gallstones, reflux, infection, bleeding, lung or breathing problems may occur related to surgery. Bleeding is observed in 1–2% of gastric sleeve surgeries. However, it is easy for surgeons to control. The age and weight of patients play a significant role in risk ratios. Patients must strictly adhere to the recommended diet, otherwise the whole process may fail.